Thanks so much for joining us for this edition of Healthline 3. I'm Carly Flynn Morgan. Today we're talking about the topic of Botox injections for migraines with Dr. McIntyre Bridges of Bridges to Beauty. He'll be answering your questions for the next half hour. We want to encourage you to ask what's on your mind. If you're online, just click on the orange Healthline 3 box halfway down the right side of your screen. Type in your question and submit it, or just give us a call. The number is 318-219-4569. You can call anytime from now up until 12:30, and the doctor will take your calls live. Thanks so much for being here, Doctor.
Carly, I enjoyed it.
So, first of all, tell us a little bit. People know that a migraine is a bad headache, but it's more than that. Tell us some of the symptoms that would get you diagnosed with migraines.
The migraine headaches versus tension headaches. I mean, a lot of people get tension headaches, and it's usually kind of a mild to dull pain, in the forehead region. Whereas a migraine headache is a very debilitating headache. It typically, by description, headache in one area, maybe two, intense throbbing. Can evolve into nausea, vomiting, photosensitivity, lay people up in bed for the rest of the day, if not a couple of days.
And what makes something a chronic migraine? That's a little different than getting a regular migraine, right?
Yeah, well, yes and no. From a standpoint of chronicity, it's not like they don't call people who have chronic headaches those people who have had it for years and years and years. It's defined as those people who have 14 or more days of headaches per month.
Okay, and who is generally most affected by migraines and chronic migraines? Does your age or sex or race have anything to do with it?
Well, actually, from a standpoint of gender, females are much more likely to have migraines. 11% of the population are affected. Lower income, blacks tend to have significant amount. White women tend to have probably the most.
That's kind of interesting. Mm-hmm. What would lower income have to do with a migraine?
Well, the thoughts are, things that can trigger migraines or stress, certain types of foods, especially fermented foods like cheeses, red wines, soy sauce. It seems to be some type of chemical induction that triggers the migraines in those people.
So one of the treatments that has been approved for chronic migraines is Botox. Mm-hmm. When was it approved for this use, and how did they figure out that Botox, that I guess was originally used to treat wrinkles and help aesthetics of people, I think, worked in this way?
Well, Botox is interesting. Its original intent was to stop periorbital spasms. And then when they found that it helped with wrinkles and stuff, that's when it evolved to the Botox cosmetic. What they found was when they were injecting people for the wrinkles and the frown lines, that a certain number of those people who had chronic migraines would get better. And so they had studies and came up with the indications for using Botox, primarily in those people who have chronic headaches. It seems to be the most beneficial, and chronic being those people with 14 or more days per month of migraine headaches.
Botox is associated with botulism. Is that correct? Mm-hmm. I mean, is it? So I know they were using it at first to treat what you said, but how did they even figure out that was something that could be used to treat people for anything at all if it's toxic?
Well, I mean, the way it is toxic is that it paralyzes muscles. And the thinking behind it was there's a certain portion of the molecule. Botox, in terms of bacteria, puts out a certain molecule, and its size is actually bigger than what you find in a Botox. And what they did was they found that if they can cleave off a certain portion of the true poison, then basically you could localize the residual and block specific muscles instead of having a generalized bad effect from Botox. So how does it work to treat migraines? What about it? And where do you have to put it to improve the symptoms? Well, the first thing is we don't know how it works. My personal opinion is that In the areas where the nerves go through muscles and the muscles are real active, and the fact that basically yanking those nerves around will initiate your migraine headaches. I found in my office, because I deal with a bunch of women in terms of cosmetic surgery, but I do when they come in, they have a migraine headache, I can generally stop it while they're there, not with the Botox, okay, but if I inject a local anesthetic, okay, along the nerve distribution that they're having the pain, it immediately goes away. So that brought me to the conclusion that basically it's a nerve irritation issue instead of having anything to do with initiating on the inside of the brain. If it was on the inside of the brain, I wouldn't be able to stop the headache instantly because I'm not doing anything on the inside of the brain.
Well, we have a caller at this point. Her name is Susie. Susie, thanks so much for calling. What's your question for the doctor?
Hi, I have a question about whether insurance usually covers this procedure.
I think in some cases it does. I mean, anything that's FDA approved generally trickles down to an insurance reimbursement.
Like Medicare or?
I'm not sure. I mean, most of mine that I'm doing is really for cosmetic regions, and I find that it helps them. In fact, they'll say it does reduce their frequency as well as the intensity. I don't take much insurance, but like if you went to a neurologist or family practitioner and things, and they were treating your migraines and using Botox, they could probably get reimbursed for it.
Okay. Very good then. Well, thank you very much.
All righty.
Susie, thanks so much for calling. So is this Botox effective on all forms of migraines?
No. When they do the studies, they're actually injecting every area they feel is a trigger point. You can find trigger points in people with migraines. Generally, I find them by tapping over the area where that nerve distribution is and finding what is called Tunnel sign. The most common Tunnel sign that we know of is when we hit our funny bone and get that electrical shock that goes down to the fingers.
That's the worst.
It is. But you can find those in areas along the distribution of the peripheral nerves where they're having the pounding. Like the one-sided headaches have to do with the supraorbital nerve that comes out of the top of the bony orbit and travels all the way back to about 2/3 of the scalp. You can generally find a Tunnel sign along that. Most commonly, it's at this origin here, where the nerve has to squeeze through a small hole to get to the outside. If that hole gets compromised or the nerves get squeezed upon, kind of like carpal tunnel, that's when you have symptoms. And for the head, when you have symptoms along the fifth nerve, it's kind of like when you have a abscessed tooth. It's like having a migraine headache because it throbs. Okay, It doesn't feel good, and it's very, very intense. Same nerve innervates, upper facial and head region, mid face, as well as the jaw region. And so once it gets involved in things, it's not a fun process.
When you're using Botox cosmetically versus to treat migraines, is there a difference in the amount that you have to use?
Yes, and the difference in the amount is because they inject about 20 to 30 sites. And so,
for the migraines?
Yes, it can be up to like 180 units. Whereas typically when you're talking about doing for cosmetic regions a particular site, you're talking about maybe 20 units, so maybe a little bit less. You can spread some of that around. But they usually use more.
How painful is it to get Botox injections in your face and in your head? Do people complain about it?
They complain about it, but they like the results. So
right.
It's very short in terms of that discomfort. But you're sticking a needle in somebody's head. With the migraines, I mean, it's the same thing. I mean, I have a patient who comes up from Austin, Texas. She's been doing it for I don't know, as long as I can remember, and she has migraine headaches, or used to have migraine headaches that send her to the ER every time. She has very muscular corrugators. That's where that nerve comes through. She also has some points that I found in her temporalis. I think she might grind her teeth at night, and where that muscle connects to the cranium. I think it's like having tennis elbow. You have little fibers of the muscle pulls away, chronically irritated, because you can push on those areas, and she would start to have that same discomfort that she would have in her typical migraine headaches. And so I injected that region because if you settle the muscles down there, in that region and stuff, then it has a chance to heal essentially, and it doesn't initiate a trigger for a full-blown migraine.
It's probably like any kind of surgery that you get to improve your health. Of course, the surgery or the injections are going to hurt, but if you're having 14 days or more a month of migraines, it's going to be nothing compared to the improvement that you're going to get.
That's correct. And there's some actual surgical procedures that have been used to treat migraines. They generally involve decompressing the nerve, kind of like if you would with carpal tunnel syndrome. And there's some very good results. I mean, does it work on everybody? No, but those people who have chronic migraines, of that frequency, certainly don't mind trying.
Once you say you go in for your first treatment, and once you get the injections, when does it start to work?
Well, it takes just for Botox to set up anywhere from 5 to 7 days. Some people earlier, some people later. In the studies that, by the second treatment, every 12 weeks, that's when they see the most reductions in symptoms as well as frequency. So it might take you 2, sessions to get to where, it is plateaued. And it probably has to do, again, with the nerve compression theory, in that the real bulky muscles, they'll squeeze upon the nerves. Nerves don't take a joke. I mean, they don't have a great deal of blood supply going to them. You irritate them, they'll let you know real quick.
And so it's one of those things where you have to keep going back, and it works. Does it work better over time, or over time you just have to keep going so it doesn't wear off?
It appears to work better over time. But when it wears off, because you'll get that muscle motion back, the nerves again, they get irritated. I think you have to keep it up.
I had a friend that had this done, and she had the injections in her head, and it did kind of paralyze her forehead. You couldn't tell when she wasn't talking, but if she kind of looked at you and she said, "Look, I'm trying to move my head." Can you see where you get the injections, even though it's not cosmetic? Will it change your look? Yeah,
I mean, you'll look better. I mean, it's just, you won't have to frown. I'm certain that basically if you got a headache, you're doing this all the time, and those muscles just get bigger. And again, the bigger they get, that poor little nerve is tethered right here, and it's being yanked against the bony side, so it irritates it. That's why I think that basically it works the best. But they do look better, no doubt about it. They might come back for that alone.
Right. A lot of reasons to come back for it if it works for more than one thing. So how helpful is this percentage-wise? People that get the injections, do all of them see some sort of improvement? How many days improvement a month? Is there any research about that?
Yeah, it appears that between 70 and 80% of people get a significant improvement. 20% don't.
That's a pretty good statistic.
Not bad. And that's why you get FDA approval. I mean, versus placebo and things, if you get a very positive effect, and then that's why it's approved. It took them, I don't know, probably 6 to 8 years to get that approval.
Let's see here. So how much does this cost? If someone's thinking about this, it's a significant investment if you have to go back every 12 weeks. What are people looking at as far as that's concerned?
Well, if you have one session, and again, you're using somewhere between 180 to 200 units. I mean, most of the units go for about $12 a unit, if not a little bit more. The price of Botox keeps going up. And so it might get a little bit more expensive. But, in trade-off, those people that get 80% reduction in their migraine headaches, it means they're cutting back on the Imitrex and the other medicines that they're not cheap either. So I think basically also, it's not so much getting rid of that cost, which is significant. It's just that the relief is so much. I mean, who would want to be laid up in bed 14 days out of the month?
Yeah, I was looking up some statistics before we started this show, and it said there are millions of days of lost work and school just because of people who suffer from migraines.
Right. I had a secretary that used to get migraine headaches, and actually hers would begin in the right side of her neck and then progress across the forehead. And then again, she was home, nausea and vomiting, dark room, the whole bit. One day she started to have one, and I just took that lidocaine and marcaine and numbed the area along the greater auricular nerve, which is in the neck, and it stopped completely, and she kept on working. It works.
That's pretty good, yeah.
It is. And the headache doesn't come back when that anesthetic area wears off. You would think, okay, well, you block that, as soon as it wears off in 4 hours, it would come back. That was never the case.
Are there any risks to using Botox to treat migraines?
Well, with the number of units that they use to get the results that they want, if you get some intravascular, placement of the Botox stuff, they might feel a little fatigued. Okay, the ones around the eye, your biggest risk is dropping that eyelid, just like if you did it for cosmetic reasons, because the little nerve that comes out is right at that top of the orbit, and if you get any Botox behind there just because of the diffusion, you can have a little lid lag. That's probably your biggest risk.
You mentioned a minute ago about medication for migraines. Once people get the injections, are they still free to take medications if they want? How does that work?
Yes, they can. Most of them nowadays will take it when they feel one coming on. But the Botox doesn't interact with it. They're free to take the medications.
Are many people allergic to Botox and what's in it? Do people ever have allergic reactions?
It's rare. People can develop antibodies to it. I'm not sure if there's any reports of an actual anaphylactic reaction to Botox. I know in my practice, just for cosmetic purposes, if I have a person who's been getting Botox for a long period of time, and it looks like it might becoming less effective for them, I'll change it to a different type of neuromuscular blocker, like Xenamin, and that seems to work better for them.
If someone thinks they may be suffering from migraines, maybe they've been diagnosed with them, maybe they haven't, how do they go about getting these Botox injections? Do they have to have a referral to you? Do they just come into you and describe their symptoms? How does that work?
They can come in. We can talk about it. They'll fill out this little migraine, a little worksheet. Neurologists do it. And family practitioners can do it. Sometimes they'll refer them to the neurologist. But people who do a lot of chronic headaches is usually probably, let's see, the numbers were $1.8 billion in Botox is spent on migraine headaches.
That's a lot of money. That is quite a bit of money. Yeah. So how many people who come in who don't complain of migraine headaches or other problems who are coming to get it cosmetically, do they mention another benefit to you? That hey, my headaches went away, or, anything else like that?
Yeah, that's common. My headaches went away, especially the ones that are severe, like the migraine headaches, even tension headaches in a lot of cases go away.
Can you use Botox on any other part of the body for any other ache or pain or symptom besides cosmetic or migraine?
Well, yeah, you can use it on people who have spasticity problems, and it really, because you're trying to...
Like spasms, do you mean? Like muscle spasms?
Muscle spasms, people with, birth defects or things along the lines that have an associated spasm with it. I've used it on actually nerves, like neuromas in an amputated stump. I have a patient who can't wear his prosthesis because it was too sore, and he was told by orthopedists and other people that basically he needs to be in a wheelchair, but he was a little bit hard-headed. He didn't want to. I love him to death, but and so I've tried several things for him. I found that Botox works very good to reduce his discomfort about 80 or 90%. Okay, now theoretically you would think, well, why does Botox have that effect on him? There's some evidence that Botox has a direct effect on what are called neuromas. A neuroma is where you cut a nerve, like an amputation, okay, and nerves don't know that limb is not there anymore, so they constantly try to grow back.
The nerves try to grow back?
Absolutely. Nerves will always try to grow back, and what will happen typically is those nerves, where they're trying to grow back, will get into some scar tissue and they'll ball up, and that's called a neuroma. And neuromas have an innate or a innate throbbing. In other words, it's almost like a pacemaker, like your heart and things. It always sends signals back upstream. Your brain can't interpret that, and so it defaults to that's painful. And so by injecting him with the Botox, it probably, like I say, eliminated, 89% of discomfort. It allowed him to be in his prosthesis for up to 4 to 6 hours before having to take it off because it's so uncomfortable. And so it has some benefits other than cosmetics or spasm. Its role in nerves is still not clearly understood because it's a neuromuscular blocker. Why the heck should it work on a nerve?
I think that it's really interesting that you don't quite know how it works, but it surely does work.
Right.
It's just one of those things that has worked on so many people. It's kind of interesting that you can't figure out, scientists can't figure out quite why.
Well, we know how it works on muscle. I mean, it blocks the transmission of nerves. You have a nerve that comes down to the muscle and stuff, and then a little chemical comes across, and then it causes contraction of the muscle. We know that it blocks that particular receptor. Okay. We don't understand why it works on migraines, other than, like I say, my theory is that there's too much movement around a certain nerve and it's irritated. And we certainly don't know why it would work on a neuroma.
Well, can we touch a little bit on how Botox works cosmetically, since we're talking about it? Is it used, so it paralyzes, but how does it get rid of wrinkles by paralyzing?
Well, all the wrinkles that, from here up are due to muscle motion. The skin as it becomes less elastic over time, and every time you squeeze that muscle, it's like an accordion. I mean, basically, if there's enough elasticity that will go along with the excursion of the muscle underneath it, you wouldn't have wrinkles. Okay? But as the elasticity goes away and it becomes more plastic than elastic, as that muscle contracts, you'll start to see it kind of undulate. Okay, as wrinkles that aren't etched in yet. Okay, but are working their way into that. Over time, as the skin becomes even more plastic, it's like taking a credit card. You're trying to get rid of it. You bend it back and forth, back and forth, back and forth until you etch a line in it. That's where you get the permanent wrinkles. That's where you get the ones that basically are etched into the dermis versus those that, when you smile, you have good elasticity, it just kind of undulates. So by paralyzing that muscle, it just relaxes that whole area. Other ones I think look odd is if they don't move from here up, and I think you need to have some motion. I shoot for a 80 or 90% reduction in the motion. Anything over that, I think it looks a little plastic doll-like, and like I say, you can't tell how animated they are. I just think it looks weird.
And you can tell that by watching, movies and celebrities sometimes. Unfortunately, women who get in their 40s, 50s, 60s, some of the actresses do that to their face, and you can't tell how they're acting anymore. You can't really tell their expressions on their face. Yeah. So I can see how important it would be not to go too far with it.
Right, and there's some actresses you'll see that only thing that moves is their lower lip when they talk, and they Botox the whole upper lip, and that becomes problematic from a standpoint. If you're trying to drink through a straw, you're not going to be able to do that very well, or even with a spoon. I mean, it's just I guess you have to stay with more solid foods.
That's really interesting that it would impact everyday things that you do like that if you did it too much or in an incorrect way.
Right.
So what areas of the face do people, usually your clients, come to you wanting to improve?
Well, the places that are approved by the FDA is primarily the glabellar region, okay? And the other areas we inject, though, is the crow's feet, that's the periorbital muscle. The forehead you can do. I'm not the biggest fan in the world of doing the forehead completely, where it's completely knocked out. I only have 2 patients in my practice that I can do that, and their eyebrows don't drop. Not the eyelids, the eyebrows. What happens is the upper eyelid looks older as it becomes more crowded. Okay, and if you push your eyebrow down just a couple millimeters, the upper eyelid gets crowded. I learned that back in '98, because you do the Botox, you do it like you're supposed to do it and things, but they'll come back 2 months later thinking they need an upper lid blepharoplasty or eyelid surgery, and it really doesn't. It's just that basically when you knock out the frontalis, which is the only muscle that brings it up, it's going to drop it. You might drop it a millimeter, 2 millimeters. At some point, it's going to look a little crowded and it looks older.
What is it? Is it Botox that you can use? I know women like this part of their face that gets kind of empty, I guess, or like indented as they get older. Is that
Right.
Botox too?
No, it's generally a fill. It's like a Juvederm or a Radius. It's the shadows you see there are loss of volume over time. The upper lip over time tends to hug basically the upper jaw instead of flow into the cheek. It's due to muscle pull, other features that will cause that. But we tend to lose fluff there, and so you're just filling that back up to a more youthful amount. Having a little bit of nasolabial fold is normal looking. Having no nasolabial fold is not normal looking. I'll tell women that I think it looks a little chimpish, like chimpanzees, their cheek flows onto the upper lip. I don't think humans should do that.
So if somebody's watching right now and they think they may be suffering from migraines, when's the cutoff? How bad does the headache or migraine have to be, and do you have to count out 14 days a month to be able to even think about getting this treatment? What would you say someone needs to keep track of if they want to come in and see you?
Well, it's an interesting question. I mean, the studies, try to delineate chronic versus non-chronic. I think anybody that has, I wouldn't want to have headaches 13 days out of the month.
Right.
So I think just about everybody that has debilitating episodes with their migraines, are probably some type of candidate for it. If you define where their migraines are coming from, what nerve is involved, or what myofascial region is involved.
I mean, when you're talking about not being able to read, not being able to have bright light, even interact with people, work or go to school, even, one day a month of that, it's not appropriate to call in sick one day a month at work or school. That's too much. So I can see how people suffering from migraines, even that much, would want to check this out.
Yeah, it wouldn't be an unreasonable thing to do, at least once or twice, because I've seen reductions with just one use of the Botox, but at 2 and things, it tends to get much better, and they keep coming back just for that.
Why is it something that wears off around 12 weeks? Why can't you make, or the researchers make a stronger dose, or why can't they give you more? Why is it something you have to keep coming back for?
Well, it's not so much stronger doses. The molecule itself, like I say, it binds to that receptor. Okay, and your body's chronically overturning all the proteins in our body, and that receptor is a protein, and so it at some point just grabs it, digests it, and sticks another one back up there. So if you have a whole new fresh batch of receptors that aren't blocked, that's when you get the motion back. So it really isn't the how long can we keep that Botox bound to, because it's an irreversible binding to that molecule. It's the fact that metabolic, we turn over all of our proteins over a period of time.
How many clients do you see weekly coming in for you for Botox for migraines and for Botox for cosmetic reasons, or a crossover?
For migraines, it's probably about 2 or 3, because I don't kind of advertise it for that per se and things. I do it, but it's just that it hasn't been something I've really gone out there and promoted. But for cosmetic reasons, probably 20 or 30 per week. So it's much more popular for the cosmetic reasons than it is for the migraine. But maybe the people just don't understand why it will work for migraines, and specifically why it will work for particular types.
It seems like it would be a good alternative for cosmetic surgery or surgery for a migraine, something that might not be that invasive or that permanent, or something could go wrong with it. It seems like it makes a lot of sense.
Yes, it does. Yes, it's fairly simple. It takes, a little less than 10 minutes to do, and then it lasts for 12 weeks or longer. I've had people that last for longer than that.
You said it takes about 10 minutes to do, which I didn't ask, which is interesting because that's not very long at all. And then do people have to, go home and rest because of the injections, because they're a little painful, or could they maybe go back to work?
They generally go back to work. It's painful when you're injecting. Afterwards, really haven't seen any problems with pain. You know, they're in the little pamphlet that says some people can get headaches afterwards. I rarely see that. I don't remember the last one that did.
Well, it seems like a really good solution to cosmetic issues as well as migraines. Really important for you to come and talk about that today. Hopefully it helps a lot of people who have been watching.
Hope so, yes.
Dr. Bridges, thanks so much for talking about it. You said you don't really promote it, but now you have, and we wish you the best.
I think it's educational.